Hello, my name is Laura Barton, and this is my presentation for my capstone project in the class NUR 213. Alright, for my project, I'm going to be reading my presentation. It may be a little hard to read, so I'm just going to tell you everything that's on it. And this is my title slide. It says NUR 213 capstone, has my name and the date. Okay, and my case study reads, Mr. Jones is a 40-year-old male of the lower class. He is African American and practices Christian beliefs. He has a 10th grade education. He works in a factory 5 days a week. His job consists of lifting and carrying heavy objects multiple times a day. He has no comorbidities and has worked in this factory for 5 years. He enjoys his job. Mr. Jones injured his back 3 days ago when lifting a heavy object from the floor. He continued to work and the pain became worse. He took 2 days off from work to rest his back. He did not want to go to the doctor because he felt he could not afford it, but when the pain did not go away, he was forced to see his family doctor. Okay, and his vital signs are blood pressure 140/85, respirations are 20, temperature is 98.8, pain level was a 7 out of 10, and his heart rate was 100. Blood pressure is increased, respirations are increased, pain level is high, and heart rate is increased. These vital signs may be increased because of his pain, which can cause slightly increased vital signs. The objective data found at the doctor's office was Mr. Jones had a grimacing facial expression with movement. He had shuffling gait. He had tachypnea. He had poor grooming, and he was unable to stand up straight. Now, his facial grimacing was obviously from pain when he was moving his back. Shuffling gait, because it was hard for him to move because of the pain. Tachypnea is because of the pain also. Poor grooming, maybe because with movement, he has pain. It's hard for him to groom himself. And he was unable to stand up straight from the pain also. All of this has to do with his pain. Okay, Mr. Jones had some complaints when he came into the office. He complained of a stabbing pain with any movement to his or of his back muscles, which is common with back injuries, that stabbing pain. He also had a constant dull pain without movement, so he was hurting. Even if he wasn't moving, he was hurting, so he was in pretty bad shape. And this could have came from him resting his back for 2 days. He could have gotten stiff. He had an inability to properly brush his teeth or hair because of the pain, which explains his poor grooming. Also, he was stressing about not being able to go to work and pay his bills. Remember, Mr. Jones he's a part of the lower class, so he really depends on his job, to get his bills paid. And now he has this medical bill on top of that, so I'm sure he's stressing out. Alright, here's some case study questions. First question reads, What do you think caused Mr. Jones's back injury? And the answer to that is, it is possible that Mr. Jones is not properly educated. Remember, he's only has a 10th grade education. He's probably not educated on how to correctly lift heavy objects. It's likely that he lifted it without using the correct form and strained his muscles in his back. And then the rationale behind that is using improper form when lifting heavy objects can cause injury to a person's back. And the second question reads, as you know, the patient's vital signs are abnormal, but Are they expected for Mr. Jones's presenting problem? Why or why not? Okay, the answer to that one is increased respirations, heart rate, and blood pressure are all expected finds when a person is in pain. And the rationale behind that is increased vital signs are how the body responds to severe pain. Okay, question number 3 reads, why would you predict the doctor to prescribe Mr. Jones? What would you predict the doctor to prescribe for Mr. Jones and why? Okay, we would think that it could be self-treated, but the doctor may choose to prescribe a physical therapy session to get a more in-depth evaluation. He may also prescribe a muscle relaxant to help with the pain. The rationale behind that is a physical therapist specializes in muscle and bone therapies, so they can assess the patient deeper than the doctor can. Okay, next question is, what are some non-pharmacological ways the doctor could teach Mr. Jones to treat his back pain at home? And that answer is Mr. Jones should avoid bed rest and stay active. The use of over-the-counter NSAIDs can be used to relieve moderate pain. Bed rest, the rationale is that bed rest can lead to muscle stiffness, pain, and discomfort. And then the next question reads, what are some holistic therapies that may help Mr. Jones? Massage therapy and yoga can help relieve back pain, and the rationale behind those are that they can both relax the muscles. And then the next question reads, what can be taught to Mr. Jones to help him prevent any future workplace injuries? And the answer would be, to prevent future workplace injuries, the correct body mechanics for lifting and carrying heavy objects should be taught. And that rationale is using proper body mechanics restrict the body from abnormal movements which strain the back. Okay, and the next question reads, what would be the best teaching method to use to ensure Mr. Jones has learned what has been taught to him? Okay, and that answer is proper body mechanics should not only be told to the patient, but should be demonstrated, and the patient should teach back what has been taught. And the rationale reads, by having the patient to teach back the information, the doctor can assess how much the patient has learned. Okay, next question. Is there anything that the workplace could do to prevent these types of injuries? That answer would be, the workplace could hold a class during orientation for the job to teach proper body mechanics related to the learner's line of work. Rationale, teaching this before the learner starts work can greatly prevent injuries. Okay, and the next question reads, who is the most at risk for this type of injury? Answer, everyone is at risk for this type of injury. The people who are most at risk would be people who have physically demanding jobs, constantly lifting, pushing, or pulling heavy objects. And then the last question reads, what can you do in your community to help reduce the instance of this problem? And that answer is, in my community, I could hold a class teaching proper body mechanics. This class would be for people who are taking the ACT Work Keys test, which is a test for people who may plan to have jobs that are physically demanding, like in factories or plants. The rationale behind that is learning proper body mechanics early on may help learners to avoid injury by implementing what has been taught. Okay, so these are my diagnoses that I came up with for Mr. Jones. He had a risk for injury related to back pain as evidenced by shuffling gait. Another one was acute pain related to back injury as evidenced by facial grimacing with movement. pain score of a 7 out of 10, and elevated vital signs, which is a sign of pain. Also, he had stress overload related to back injury, as evidenced by patients stating feeling stressed out about being out of work and worries of paying his bills. Now, my top nursing diagnosis was risk for injury. Why? Because safety is huge. Now, I know this is only a risk for injury, but it's a really big risk for injury because, well, he's already injured. For one, we don't want to make that injury any worse by having a fall because of his shuffling gait. And he's also unable to stand up straight, so he has shuffling gait. He's kind of hunched over. That's a huge risk for falls, which has the potential to greatly injure his back, which is already injured, and we don't want that. So safety is key, and that is why my top nursing intervention is to teach the patient to keep nearby objects close by, because if everything that he needs is close by, then he won't be getting up, walking around to look for it. He should have things like the remote, maybe a few snacks, something to drink, cell phone, everything like that should be close within reach. Maybe even a bedside commode if he needs that. That way, it will greatly reduce his risk for injury until he is able to be assessed and his gait is back to normal, or at least as normal as it can be, considering that he is injured. And this is just a 5-question Kahoot. It will show you the 5 questions and the 5 correct answers. If you would like to, you could play along. Thank you.